This learning module addresses the various overuse pain problems of the neck and arm region and how to avoid them. The neck often contributes to upper extremity pain problems as the blood supply and nerves to and from the working arm and hand must pass through the neck muscles. Therefore, your neck muscles can affect how well your arm and hand will tolerate work. Many physical therapists agree that the neck can contribute to many, if not most, upper extremity pain problems. This risk gets much worse if you have a forward head, slouching, round shoulders posture habit. Normally, the weight of the head should be balanced directly above the rest of your spine. Forward head posture places that weight ahead of your upper back, increasing posture loading at your neck and upper back. This also tightens muscles on the sides of the neck. These are the muscles that can squeeze the nerves and blood vessels to your arm and hand. This risk gets much worse if you have a forward head, slouching, round shoulders posture habit. Normally, the weight of the head should be balanced above the rest of your spine. Forward head posture places that weight ahead of your upper back, increasing posture loading at your neck and upper back. This also tightens muscles on the sides of your neck. These are the muscles that can squeeze the nerves and blood vessels to and from the working arm and hand. Reducing blood supply and pinching nerves to the working arm and hand can increase the risk of tendonitis and carpal tunnel syndrome, which we will address next. Simply being aware of this and paying attention to your posture as you work can go a very long way toward reducing your risk for work-related overuse pain problems in the arm and hand. As a physical therapist treating work-related pain problems, I am every day telling patients the best thing they can do is to hassle themselves all day to be an inch taller. One of the best ways to prevent and reverse neck stress inputs to arm and hand pain is to frequently perform two very easy, very simple micro stretches that reverse the effects of forward head posture while working. The first is a chin tuck that briefly overcorrects your forward head posture. This is done by bringing your head up tall. Be an inch taller is our motto for this. So bring your head tall, tuck chin in, draw your shoulders back. This would be a position of military attention in boot camp. Hold 10 seconds, then back off a bit. The muscles on the sides of the neck can get tight with forward head posture. These are the muscles that can squeeze nerves and blood vessels to the arm and hand. Stretching these gently, but often, can reduce arm and hand pain risks. Bring your head tall, hold your shoulder down, tip your head away toward the other shoulder. Be aware, do not turn your head away from the stretched side. This is a common error. Keep your nose pointed straight forward, not to the side. Hold the stretch gently 10 seconds. Also note that these are breathing muscles, so exhale as you do this stretch for a better effect. You can and should do these frequently throughout the workday. Don't wait for a scheduled exercise break. Just do these often, especially when challenged by work demands or stress or early pain problems or discomfort. Another risk factor that contributes to neck and arm pain problems is how you support your arms during hand tasks. Your arms literally hang from your neck by your neck muscles. Your arms and whatever they are holding add considerable loading to your neck. But if you are able to set up your workstation so that your arms may rest on the work surface while performing hand tasks, this can greatly reduce neck loading, which then reduces arm and hand overuse risks. The common arm and hand pain problems we will address include tendonitis, tennis elbow, golfer's elbow, carpal tunnel syndrome, and other work-related overuse issues seen in the workplace. The work demands that risk these problems include prolonged, unchanging posture, such as sitting all day, even if that may be what some might call good posture. Sustained posture, even good posture, creates sustained loading to a variety of joints with sustained pulling of a variety of tendons and muscles that work to hold that posture. That sustained workload cuts into the blood supply of those tissues. Then, of course, awkward posture creates great mechanical strain to the tissues. Also, repeating the same movement pattern over and over also cuts into the blood supply to working tissues. Grip, pinch, and pulling will risk tissues if they are sustained or repetitive or heavy. Vibration also adds risks, and especially poor physical fitness on the part of the worker. Tennis elbow is a tendonitis of the wrist muscles, where they originate at the elbow. Tennis elbow comes from holding or pulling loads in the hand across the wrist, pulling on the wrist tendons, where they originate on the outside of the elbow. So tennis elbow is a hand and wrist loading problem. We reduce tennis elbow risk by reducing the load in the hand or reducing the time spent holding a load in the hand, as well as frequently performing microstretch to these tendons. We may lighten tools being used, reduce hand loads, change work techniques, rotate job tasks, and stretch these tendons gently and often. The microstretch to avoid tennis elbow is easy and effective. Hold your arm straight at the elbow, palm down, close your fist, curl the wrist down, and turn the fist a little toward the outside, as shown in the picture. Some people have been taught to do this stretch with the hand open. This is incorrect, as it misses stretching an important part of the tissues involved in tennis elbow. It should be done with the fist closed, as shown in the picture. Golfer's elbow is similar to tennis elbow, except pain is on the inside of the elbow, involving the wrist muscles that bend the wrist forward and the muscles of grip and pinch. We try to avoid golfer's elbow by reducing the amount of time and force and repetition of hand grip and pinch. The microstretch to avoid golfer's elbow is done this way, with the arm straight at the elbow, palm up, hand open. Tip your hand backward, adding a stretch by gently pulling on it with the other hand as shown. Hold the stretch gently for 10 seconds. People have been taught this one incorrectly as well. They may have been taught to do this stretch with the palm down. This misses an important muscle, the pronator muscle, which is often the source of this tendonitis. So do this stretch starting in the palm up position as shown. Carpal tunnel syndrome is a pinched nerve at the wrist, affecting fingers 2, 3, and 4, plus causing pain and nerve symptoms in the wrist that can run up the arm, sometimes all the way to the neck and shoulder in some cases. The median nerve enters the hand by passing through a very tight confined space between the carpal bones of the wrist. Overwork at the wrist can irritate that nerve, causing it to swell within the carpal tunnel. There is no room for it to swell within the carpal tunnel, so the nerve can be damaged. Tight neck muscles can also squeeze that nerve where it passes through the neck and shoulder region. This can make that nerve swell along its entire length, including when it gets to the carpal tunnel, thus risking a pinched nerve within the carpal tunnel at the wrist due to tight neck muscles. Risk factors for carpal tunnel syndrome include prolonged grip or pinch, heavy grip or pinch, wide grip, tiny grip, slippery grip, or grip with a bent wrist. Vibration is also a risk factor, such as holding a vibrating tool. There are also medical risk factors, such as wrist or thumb arthritis, hormone risks such as pregnancy or menopause, diabetes, obesity, and connective tissue disorders such as rheumatoid arthritis or lupus. We avoid carpal tunnel syndrome by reducing grip force, grip duration, grip repetition, reducing the weight of the tools, reducing vibration of the tools, making grip more tacky and less slippery. We seek grip that is approximately index tip to thumb tip in size. We may seek to reduce grip and pinch time by rotating job tasks frequently. Microstretching can also be especially important where ergonomics cannot be adequately improved. The microstretch that seeks to reduce carpal tunnel syndrome risk is the same one we described for golfer's elbow, as this stretch will affect those muscles and tendons that contribute to both golfer's elbow and carpal tunnel syndrome. One of the most common, most disabling, and most costly overuse problems in the workplace is shoulder pain, particularly rotator cuff problems. These can be very difficult. These tendons can degenerate from overuse and aging changes. They can become brittle and frayed and stiff, easily irritated. They are surrounded by bones that can rub on them. These bones can grow bone spurs that can irritate and damage the tendons. The shoulder is vulnerable to sprains, degeneration, tears, and impingement between bony edges. Rotator cuff muscles that lift the arm for reaching are very short muscles, only 3 to 4 inches long, lifting a very long and very heavy arm. The work risks that can stress the rotator cuff include reaching that is high, reaching that is far out from the body, reaching often, holding a reach position for a long time, and reaching with a load in the hand, even a light load. You can reduce the risk to the rotator cuff by reducing how high you reach by just an inch or two, how far away from the body you reach by just an inch or two, how long you hold the reach position, and how much load is in your hand when you reach. So reducing height or distance reached by just a bit can greatly help. Reducing the duration of holding your arm in a reach position just a little bit can greatly reduce rotator cuff loading stress. Rotating job tasks can reduce rotator cuff risk exposure. Microstretching often on reaching jobs can be critical in avoiding serious rotator cuff risks. The microstretch for the rotator cuff is very easy and can be very effective. Simply stop what you're doing, bend over, use your other hand for support as you dangle the overworked arm down. Relax the arm as you swirl it around, perhaps 2 feet in diameter, 10 times each way in a very relaxed manner.